There were 6 new locally acquired cases from yesterday we've reported today, and 0 new cases from overseas travellers. A further 6 people remain in hospital, with 2 in ICU. Both of those are on a ventilator, and we send our best wishes for a quick recovery for those people. There were 29,631 tests yesterday, particularly as we ramp up our targeted testing in response to the new cases, and Jerome will go into more details about those really quick targeted testing that's been mobilised across local communities. There were 18,901 people vaccinated in the state-run clinics yesterday, and a substantially higher number looks like coming in from our GPs yesterday and our primary healthcare networks yesterday. That takes us to some 1.738 million people vaccinated through our state-run clinics. And can I take this opportunity just to remind people again, please come forward as soon as you are eligible. Yes, the supply issues continue to constrain us, but please come forward and get vaccinated. Of the 6 cases that we've reported today, 3 of those cases are linked to the Hobsons Bay community outbreak, 2 of whom we reported in our media conference yesterday. And those close contacts of so those 3 all live together in a different household from the original 2 of the Hobsons Bay outbreak. The other 3 cases are linked to the City of Maribyrnong community outbreak. One of these is the housemate of the Index case. The Index case works at Derrimut. The housemate is a cleaner, and the public health team are investigating the movements of that person. I can confirm that he worked at the Epworth Hospital in Richmond as a cleaner. It would appear in the administration area, not in the wards, and we are working with that hospital to assess who he may have come in contact with. The other 2 related cases are close contacts that live in a different household to the Index case. One of these attends the Warringah Park Special School in Hoppers Crossing, a particularly important school that looks after some of our most vulnerable kids. And we are working through with these school community and with this person when they may have been infectious and what their movements would have been throughout that period. So that's the 6 cases that we've reported today. When we continue to work with all of those cases and all of the communities that they've come in contact with through our contact traces, there are many, many interviews going on, and we are working out the movements both upstream in terms of what may have been acquisition sources and downstream as to where people have moved in their likely infectious periods out in the community. We are also identifying as a result of that many close contacts and ensuring that they both isolate and get tested, because of course this is the important work of how we get ahead of this and stop the spread of the virus.